Hi, Dr. Roseann here, and we're going to talk about, does your child have PANS or PANDAS? I am an integrative and pediatric mental health expert who's on a mission to change the way we view and treat children's mental health. If you're new to my channel, hit subscribe and turn on your notifications so you get my videos every week. Let's dive in. You may have heard about PANS and PANDAS and may be wondering, does my child have PANS or PANDAS? What are the signs and symptoms, and what do I do about it? PANS and PANDAS are two distinct disorders that have a similar way and they present themselves, and that's why we talk about them together. PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with a Streptococcus Infection. That's a mouthful. PANS and PANDAS are two distinct disorders that typically result from infectious disease sources like tick-borne infection, Lyme disease, Loriciosis, Babesia, Bartonella, and a host of other tick-borne infections, as well as the Epstein-Barr virus. It can be COVID, and it also can come from other sources such as mold, as well as other environmental toxins. With both PANS and PANDAS, there's a dramatic and sudden onset of a mental health issue, such as rage, OCD, anxiety, particularly separation anxiety, as well as a loss of skills, particularly bladder functioning or regressive behaviors, or a loss of handwriting is a very common one. Even though with PANS and PANDAS, there's a sudden onset and it's a dramatic onset, you also can have a pre-existing condition, which can be quite confusing for people. You can have had anxiety first, and then your anxiety skyrockets and goes through the roof, or it morphs over to a dramatic increase in symptoms that include OCD, or it switches over into another symptom. It's a different disorder, but related, called autoimmune encephalopathy. We often call it AE. And with autoimmune encephalopathy, it's the same symptoms, but it's not the dramatic onset. In PANS, PANDAS, and AE, you can have soft signs in advance. So sometimes people will come to me with a case of PANS, PANDAS, or AE. And when we look back in the history, we may have seen some subtle signs of difficulty focusing. There may be bladder or bowel issues, including constipation. There can be a lot of little signs, as well as a history of frequent infections that resolved with treatment, but there started to be an uptick. What's different about in PANS and PANDAS is really that dramatic onset that can be so frightening. The other part about PANS, PANDAS, and AE is that there can be this dramatic waxing and waning of symptoms, where what we call flare periods. Your child may have a simple cold, and all of a sudden there's this dramatic increase in their anxiety or depression behaviors, or they're wetting their bed. And then the cold subsides, and typically within 2 to 4 weeks, the symptoms that you see, the psychiatric symptoms or cognitive symptoms, dissipate as well. And then what happens is we start edging up our baseline. So maybe in the beginning, they got pretty close to where they were, but then that normal, typical range starts getting more muddied, and we're not seeing them ever return to a comfortable state, or a state without anxiety, or a state without OCD. Those flares increase. And what's important about PANS, PANDAS, and AE is that the original infection can be exacerbated by other infections. And what typically happens in PANS and PANDAS is that there are multiple infections. So it may have started with a series of ear infections, and then they got the flu, and then they got a tick-borne infection, and then they got a vaccination that sort of did them in because that was just too much for them. Not that the vaccination caused it, but their immune system was compromised and they couldn't handle the vaccination. They could have gotten a final cold or a stomach bug, and that just sort of destabilize their nervous system. PANS and PANDAS occur because it's a misdirected immune response. The body starts attacking itself. We're not really sure why this happens, but we do have some common threads. So often these kids have a history of multiple infections. It doesn't have to be the case. They tend to have genetic mutations like MTHFR, which make it harder to clear toxins, but that doesn't have to be the case. Many kids mistakenly think that PANS and PANDAS kids always have tics or OCD. That doesn't have to be the case. There's a wide variety of symptoms. I think the common thread for PANS and PANDAS is that there is a sudden and dramatic onset. A sudden onset of a mental health problem is not normal. Typically, there is a medical source when there is a sudden and dramatic onset of a mental health problem. If you think your child may have PANS and PANDAS, even though it's a very complex disorder to treat both medically and getting the right mental health help, what I'm going to tell you is there is help. There are national organizations like Aspire Care and pandas.org. We work remotely with people all the time with PANS and PANDAS, and we do a lot of brain-based treatments and do a lot of parent support. But what should you do if you suspect your child might have PANS or PANDAS? Well, first of all, you want to go on one of these national organizations and find a provider who has lots of experience with PANS and PANDAS. So you can go to aspire.care, you can go to pandas.org or Epidemic Answers and find a provider with that experience. Why do you go to a specialist? Because it's going to cut to the chase. They're going to know what tests to give and what type of treatment, and it's going to save you a lot of cost and heartache. You really want somebody who knows what they're doing because the longer it goes on, the harder it is to treat. Both from these infections get into the different organs, but these are very traumatic illnesses for everybody involved. When you have a child that has a mental health issue that is as dramatic as PANS and PANDAS and AE, you don't know what to do, where to turn. And we often think a psychiatric medication is going to help a child with PANS and PANDAS, but that's typically the worst thing we were going to do. We want to treat that infection and we want to have a protocol that is going to treat the whole child. So what's the magic formula for treating PANS and PANDAS? Well, first of all, it's getting a specialist who knows what they're doing. And you want a medical specialist and a mental health specialist who's on your team that can support your child and your family. Next, you want to make sure that you're medically treating whatever that source is, that it's igniting that PANS, PANDAS, or AE flare, because without it, we're going to be the dog chasing its tail. And like I said, a psychiatric medication isn't going to fix a Lyme infection or Epstein-Barr or mold. You've got to treat that source. Common sense, right? Well, in the world of PANS and PANDAS, when people don't always believe it exists for unknown reasons, we want to make sure we're getting the right treatment. It's critical, and a specialist will help you get there. Next, you really want to get a mental health provider who understands the stress hyperactivation in the nervous system so that you can help your child and you work on your nervous system to get it in that parasympathetic relaxed state. Without working on the nervous system, you're going to get stuck. And that's the truth. And next, you really want to work on detoxification. So many of our kids with PANS and PANDAS, as I noted, have genetic mutations. And these mutations have to do with detoxification. And we know two of the biggest barriers to healing, aside from the right diagnosis and the right treatment, are stress-activated nervous system and improper detoxification. I have been fortunate to help hundreds of families over the years, and I am working very hard to train providers about PANS and PANDAS, and I work at teaching school professionals so they can better identify so that our kids can get the treatment that they need early on. So how do you diagnose PANS and PANDAS and autoimmune encephalopathy? Well, we don't have a single lab test that is definitive. While there is lab work, again, it's not definitive. And just because your lab work doesn't show high amounts of inflammation doesn't mean you don't have PANS or PANDAS and autoimmune encephalopathy. So what kind of treatments are available for PANS and PANDAS? Since there are multiple sources of infection and environmental agents that cause PANS and PANDAS and autoimmune encephalopathy, naturally, there's not one single treatment that applies to everybody. Figuring out what those infectious environmental sources are critical in the treatment component. If it's bacterial or viral, well, there are antimicrobials and antiviral treatments available that, depending on your child, could vary. And in terms of mental health, we know that talk therapy with kids with PANS and PANDAS when they're in a flare is almost a waste of time. We want to do a lot of those type of therapies that help regulate the brain and body. I personally use biofeedback, neurofeedback. We do a lot of somatic therapy as well as EFT tapping to help regulate the nervous system. And of course, parents need parent coaching. Kids with PANS and PANDAS, to put it lightly, are a challenge to manage. Without understanding why these behaviors are happening, parents just don't know what to do. So it really means a lot of psychoeducation and teaching them about flexible and loving limits, as well as flare management, how to avoid those flares. So what's my Dr. Rowe know? Thinking that PANS and PANDAS isn't real. For anybody that loves and cares for a child with PANS and PANDAS, we know it's real. Having a sudden onset of a mental health problem isn't normal and doesn't mean your child has a mood disorder or psychosis. They could be displaying that as a co-occurring symptom. But we need to get to the root cause. And PANS PANDAS typically has an infectious or sometimes environmental trigger. And until you figure that out and treat it, your kid's going to be stuck. And what's my Dr. Rowe go? Supporting and loving parents who are struggling with a child with PANS and PANDAS and AE. This is a frightening disorder. Whether a child had an issue before or it's a sudden onset, this is scary. Parents don't know what to do. They ask their medical provider or mental health provider for help, and they often go down road after road after road that leads to not only failure in supporting this child, but sometimes worsening of symptoms. Kids with PANS and PANDAS often do terrible on psychiatric medications. They have what we call paradoxical effects because infectious disease hijacks the brain and body, and they doesn't react to medical treatments in the same way. And besides that, these are medical problems that can be treated with medical interventions that address infection, not neurotransmitter imbalances. Don't believe that every mental health problem is a neurotransmitter imbalance. We have so many medical sources. And if you're a parent looking for support, trust your instinct. Keep going until you find that answer, because you will. You will find that provider who will help you. And like I said, I'm on a mission to change children's mental health. And part of what I'm doing is training other providers. And you can find these providers by searching for national PANS and PANDAS organizations. There are providers like myself who are committed to loving and helping these families. So remember, if you or a child you care about is struggling, it's gonna be okay. I am here to show you how to help children and teens feel calm, alert, and good about themselves. I wanna hear your struggles that you have with a child with PANS and PANDAS or autoimmune encephalopathy. So drop it in the comments below. Catch you on the next episode. And remember, subscribe to the Dr. Roseann channel, where we talk about natural and effective ways to reduce and reverse mental health.